Hi, I'm Colin Potter of fightparkinsons.org, and today I'm in Austin, Texas, where I've been for the last week seeking to explore alternative therapies in treating Parkinson's. And Austin is a real live-wire centre of Parkinson's innovation. And today I'm with Sarah King of Invigorate PT, who works with clients on physical therapy and wellness and helping them recover from their Parkinson's or live well with their Parkinson's. So rather than me try and describe what you do, Sarah, perhaps you might like to tell us exactly what you do with your clients.
Sure, happy to. So I'm a physical therapist by trade. I have my doctorate in physical therapy, and I also have a background in health and wellness. I was a personal trainer, a group fitness instructor, and I've always really been interested in helping the body heal in ways that, involve natural approaches, diet, exercise. Invigorate Physical Therapy is specialized in Parkinson's, and what I do is I one-on-one work with patients diagnosed with Parkinson's disease and help them take a more holistic approach to their diagnosis. So in a nutshell, it is a lot of exercise, nutrition, stress management, and helping people sleep better. And I've kind of branded this as move, mend, fuel, and cope. And through those kind of four aspects, depending on where the person is and what they're interested in doing and what their goals are, then we tailor each program specifically to them. If they, really aren't inhibited very much by anxiety and they're eating fairly well and they just want an exercise program, we work with them on their specific physical mobility. If they are moving pretty well, but they're having anxiety attacks and their nutrition isn't in order and they're not sleeping well, then we still exercise because it's incredibly important. But we tailor a program to help them achieve wellness in these other areas of their life so that they can get the most out of their Parkinson's program.
Well, I was personally astounded when you showed me videos of before and after of what you'd achieved with some of your clients. Astounded wasn't the word, because that looked as though they'd been injected with a special drug, and then you tell me that's after just one session. So what is it that, what are we uncorking here that you do that's so special?
Well, I wouldn't say that I specifically have some magic drug or some magic sequence of events or some magic knowledge that isn't out there for the world to see. I think what's different about what I do is, number one, I think that starting with listening to where people are at is a huge component of medicine that's missed, unfortunately. And so my first session with people is an hour and a half. Oftentimes I go 2 hours with people, and I ask them about everything in their life having to do with Parkinson's and not. Where are they emotionally? Where are they physically? What are they hoping to achieve? What do they think is realistic? What are their fears? What are their biggest fears about the future? Or, what is their environment like? Do they have a social support system? And I think that medicine has gotten away from listening because of a whole host of reasons. Practitioners typically don't have the time to sit down with people and get to know you one-on-one. And because, at least in the States, our medical system is incredibly burdened from a time perspective. So physicians especially, and even physical therapists now, are expected to get people in and out as quickly as possible, give them the best option that they can, come up with in 7 minutes, or as a physical therapist, having to see 2 or 3 people at a time to make sure that you can meet the demand. And so the way I've set up my practice is to help eliminate that rush. People can't get better if they're rushed through that process. So I listen, and I try not to force people into things that they're not ready for. And my main belief is that exercise is important. Diet is crucial. If you're not managing your stress, then you're only making things worse. And if you're not getting sleep, you're not repairing your brain. But I can't come into day one, someone who's completely new to this whole realm of Parkinson's approach, and lay out 18 things that they need to be doing and then send them on their way. It's just not the way that we're built as human beings, and as patients, people get so overwhelmed so quickly that throwing information at people and then trying to let them do it on their own just fails, essentially. And so I think listening, tailoring a program to them, and then being patient, helping people understand that huge gains aren't going to be made in a day. There are some exceptions to that, especially with exercise and freezing, for example. I think a video that you're referring to is of one of my clients before and after one visit of some specific exercises for freezing. And, there are a lot of things that your body can achieve once you're just reminded of how to do things. So, with freezing in particular, I can come in and we can work through a specific sequence of events. I can figure out why you're freezing, where you're freezing, what might be triggering the freezing, and then work with you to problem solve on how to get your brain to relearn how to walk, how to move, how to stay unstuck. And oftentimes that's the beauty of exercise, is it can unlock so many things so quickly. And starting with exercise to give people a little bit of motivation and just kind of see the results is a great segue into, okay, you think exercise is great? Imagine how great it could be if we could eliminate some of your toxins and help you heal your body through nutrition. Imagine what results could be achieved then. So that is really the foundation of what I do and why I do it for people.
Okay, that's great. So I think you mentioned the word intensity of exercise, and that particularly interests me because I'd like to know much more, because we talk about exercise, but it sounds like it's very special exercise that you promote.
Right.
Could you tell us more?
Sure. So to back up and give like an overview of a Parkinson's exercise program, I think there are 7 components of a good exercise program for someone with Parkinson's. First and foremost, any exercise that you're doing, whether it's boxing, Tai Chi, running, stretching, yoga, any exercise that you choose can be beneficial, but it has to have 7 components in it. So the very first component is anything you're doing has to be big, powerful movements. And I mentioned before that I'm a Parkinson's Wellness Recovery certified therapist, a power certified therapist. That program is based out of Arizona. A woman named Becky Farley is a physical therapist. She established that Parkinson's specific program with the help of some of her coworkers. And it's a wonderful system that helps Parkinson's symptoms specifically. And what we're really learning through the research is that big, powerful movements help to reactivate the Parkinson's brain to move in a more normalized fashion. So the example that I often give people is, with Parkinson's, your brain sends a message to your body. My brain tells my arms to go out this far. My arms, because I don't have Parkinson's, match where I want them to go. Okay? Yeah. If you have Parkinson's and you're telling your brain, or you're telling your body to go this far, what your body hears, and this is very simplified, is this. So I think, as a Parkinson's person, I think I'm out here, sure, but I'm actually here. And so a lot of the strategies of the big, powerful movements have to exaggerate your movement. So as a Parkinson's person, you think you're way, way, way out there, but really now you're normal. You come to this normal spot. So number 1 is big, powerful movements. Number 2 is any exercise program you're doing has to be tailored to you. It has to be, for example, if your main complaint is rigidity, like I know you were struggling with from the very beginning, rigidity in your trunk, for example, your core, things that help relieve that a bit as far as exercise go are rotational movements. So spinal flexibility, some rotational through the core can help you address your specific symptoms. Now, for someone who doesn't have rigidity but wants to work on freezing, for example, that tailors more to weight shifting and stepping. And so your program has to focus on your specific symptoms, because if it's not focused on your symptoms, you're not getting the most benefit. So 1, big, powerful movements. 2, tailored to your symptoms. Number 3, and this answers your question about intensity, is it has to be physically challenging. And one of my favorite sayings is, if it's not challenging you, it ain't changing you.
Okay.
And that is so true. And there's a physical therapist at the Cleveland Clinic that I shadowed for a day. And I just remember her telling me, Sarah, you have to push these people, because I was sitting in the corner watching her work with some of her Parkinson's patients. I was watching her take people who were freezing, who were stuck to the floor, and asking them to run across the room by themselves around cones to a mat and turn around and run back. And of course, I'm terrified of people to fall, but and I was really anxious about this, and she looked at me and she said, you can't get anywhere with people unless you push them hard. And I've really taken that to heart. And so if it's not challenging you, it's not changing your brain. That's just the way our brains are wired. Physiologically and historically, if you think about where we started, our brains only change if they have a reason to change. So if you're comfortable sitting on a bike, you're not out of breath, it's not raising your heart rate or difficult at all, your brain already knows how to do that, right? So it's not going to change. And so I believe highly in intense exercise, and I never make anyone go through painful movements. If it's hard, that's okay. If it hurts, then we need to find something different. So there's a difference in painfully intense and difficult intensity. And so physically challenging is incredibly important. And then it has to be mentally. The 4th one is mentally challenging. Oftentimes something that's lost with Parkinson's is the ability to multitask. So basic example is walk and chew gum. Specific to Parkinson's is walk through a crowded grocery store while scanning the environment for your groceries. You're walking and you have to scan. On top of that, the grocery store is extra challenging because there are people around you. It's noisy. You're managing a cart. Kids are running in front of you. There's so much for you to manage. And the Parkinson's brain at a certain point has trouble focusing on more than one thing at once. This is where freezing can be a huge component. And I know you've spoken to having trouble crossing the street whenever you were really struggling. Well, think about what has to go into crossing a street. You have to make sure that you have enough time. You have to scan the road for oncoming cars that could flatten you. You have to quickly change surfaces, go from a curb to the road to a curb again, on top of, the stress of getting to where you want to be, and et cetera, et cetera. So mentally challenging exercise where you're multitasking, you have to exercise and count backwards would be a very simple example. Or carry something, scan the environment, and call out what you see. It can reach a million different combinations, but if it's not mentally challenging, if you don't have to focus on what you're doing and be mindful and present of your exercise, then it's too easy and it's not going to change you. So those are the first 4. The 3 more are fun, social, and accountable. So every program you're on, you have to be enjoying in some way. If you're not enjoying it, really you're wasting your time, and there's something out there that everyone enjoys. You just have to figure out what it is. And a social environment for exercise, whether it's one-on-one with a trainer or a physical therapist, or a workout buddy, find a Parkinson's workout buddy. That social aspect is so important in Parkinson's. And this is where I love, there's a local nonprofit that I'm work really closely with called Power for Parkinson's. And 2 wonderful women started it. Their fathers had and have Parkinson's. Free exercise classes for the whole community for people to come, and their caregivers too. And everyone can join together in the social environment. And, it's people see amazing results because they're moving more, but also coming into this environment where they see other people working hard too, and they feel that camaraderie. We're social beings, and we need that component. So, and finally, that adds the accountability piece too. You need someone to keep you accountable because, as I've heard almost 100% of my clientele say, it's hard to motivate yourself, but if you have someone that you are answering to, that is just even thinking about you, that kind of takes people from that apathy stage to just kicking you over the hump of saying, somebody's gonna hold me accountable to this, even if it's 2 stretches. I know that the next time I see Sarah, for example, she's gonna ask me, did I do those things? And if I've learned anything about the Parkinson's community, it is full of people who want to do their best and who are kind of perfectionists, to some degree. So we really utilize that and say, I'm holding you accountable. And, whether it's one-on-one, like I said, or a group environment, you need that accountability piece too. So I gave you a long answer to the intensity question because I think there are lots of things that are important to an exercise program. And those are it. Those are my 7. I actually have to add number 8, okay, because I give this talk at our local groups, and I've had a friend named George, who actually, you met George.
I did.
You met George. Every time I give this talk, this 7-step talk, George raises his hand and he says, there's a number 8. And he says, you have to leave your ego at the door. And, I think that's a really powerful message too, is because you have to get out of your comfort zone if you're going to change your brain, whether it's exercise, diet, whatever it is, you have to get uncomfortable. And, so I have to throw in number 8. You have to leave your ego at the door. So that's a shout out to you, George.
Okay, well, thank you. That was a wonderful explanation.
Yeah.
And really, you've covered almost everything. You have covered everything. I just want to just pick on one thing. And that is one of the biggest issues that many, many people write to me about is insomnia, sleeplessness. Now, you specifically mentioned ability to sleep and you must do something. What do you do that enables people to start getting a better night's sleep, which clearly is a pathway to better health?
Pathway, definitely. So sleep can be disrupted for a whole host of reasons. And the reason why one person might not be sleeping well is very different than the next. But in a nutshell, making sure that you have a good foundation, you have a good, I work with people on establishing a good nightly routine. So your brain and your body love routine. You have a circadian rhythm, and taking advantage of getting into the routine where at, for example, 8:30, you turn off the TV, the computer, you dim the lights so that your body starts to recognize that it's no longer daytime, it's time for nighttime. What happens at night is I sleep. So it's time we're in this world of continuous light, continuous stimulation. A lot of us, and I'm guilty of it too, as an independent practitioner with my own business, I'm often on the computer answering emails or, just getting caught up on stuff from the day, notes. I'm up till 10:30 on my computer. Well, computers, TVs, alarm clocks even, they're full of blue light. Light that has a blue frequency comes from our electronics. Well, that blue light goes into our eyes and actually inhibits the production of serotonin? Melatonin. Okay, yeah. So that blue light goes in and inhibits the production of melatonin. And so oftentimes I'll tell people, turn the computers off or put on a pair of amber glasses. Have you seen them?
I haven't.
Okay. They are blue light blocking glasses. My dad has a pair. My brother has a pair. You can get them on Amazon. I could share the link for sure. But you can also buy blue light blocking phone screens, computer software to take away the blue light, to minimize your blue light exposure. I'm a really big advocate of just saying, turn it all off and find something. Conversate with your spouse, stretch, go for a walk outside, sit on your deck and drink a warm cup of tea. It sounds incredibly boring, but we need to bring that stimulation level down. Beyond that, making sure that your room is a conducive place to sleep. Minimize the light, minimize the noise as much as possible. You should not have a TV in your room. I hate to say that because a lot of people do, but you shouldn't have a TV in your room. Your bedroom is meant for sleeping and sex. Those are the only two things that you do in there. You don't eat in there. You don't even read in there. You definitely don't watch TV in there. It is a sanctuary to help you sleep. So beyond that, turn the alarm clock away from your bed. Avoid caffeine, antidepressants, antihistamines, antipsychotics for like 8 hours before you go to bed. No smoking, and at least in the later half of the day. If not, just give it up altogether. And so I help people kind of feel out where their biggest deficits are in their routine. And then you have people who have specific symptoms, like they have cramps in their legs, or they have restless leg. And to some degree, at some point, what they're suffering with might be beyond what I'm trained to manage. For example, some people have very violent dreams. They have REM sleep disorder. And so I might recommend they go get a sleep test to test for sleep apnea or any other type of disorder that might be really easily treatable but hasn't been diagnosed quite yet. Restless leg, I can recommend a few topical supplements. People find real good relief with magnesium for leg cramps. I had a client who that was her main complaint at night. Her legs just cramped up at the same time every night. And so we started, just introducing some over-the-counter magnesium into her water, some gentle warm baths to help her relax and rejuvenate. And of course, exercise helps you regulate your circadian rhythm as well. So if it's within my scope, I start there, and then we see how far we can get to the point where if they need someone else to look at them for nutritional deficiencies or sleep disorders, then we'll go there next. But also getting sunlight is crucial. Getting sunlight early in the day as much as you can. Just let it hit your skin, your face for 10 minutes at a time early in the day. That'll help you with that production of melatonin later in the day. So that's the answer to the sleep question.
Wow, that really was a fantastic
I know,
answer.
You can feel how it feels to be my client. Just spew things at you sometimes.
Yeah, and this is something that's missing in so many people, this kind of guidance.
Right.
And it's not found in the medicine tablet.
Right.
Well, everyone, now you understand why I'm in Austin and why I'm delighted to be with Sarah. And this is only the start of what we're trying to do at Fight Parkinson's in sharing good practice, good information to help you live better and live well with your Parkinson's. So, Sarah, thank you so much for everything, your informative content. It's been fabulous. Thank you so much.
Absolutely.